Hello, this is Dr. David Green, CEO of the New Jersey Pain Network. Today's topic is what you need to know about spinal cord stimulator implants. This is a revolutionary device that is permanently implanted around the spinal cord in an effort to provide pain relief to chronic pain patients. It can work well for either chronic back or leg pain, or neck or arm pain. A spinal cord stimulator is considered a last resort treatment, as it does involve a surgical procedure. It's very expensive for insurance companies, and it doesn't fix the problem being faced, but it does mask pain nicely. Who benefits from a spinal cord stimulator implant? Well, it's not a first-line treatment. It is a last resort. It doesn't fix the problem, but it can replace pain with a nice tingling sensation. It's excellent for those who have failed back or neck surgery syndrome, post-laminectomy syndrome, RSD or CRPS, diabetic or peripheral neuropathy, post-herpetic neuralgia, and then evolving indications include testicular, pelvic, or abdominal pain. So what can a spinal cord stimulator do for chronic pain? It can take a person who has chronic pain, depression, and inability to work and completely turn that person's life around. It's been shown to work well for back, neck, arm, and or leg pain. Patients do need to have a trial placed first, which is a low-risk outpatient procedure. It's an excellent last resort option when surgery is no longer indicated, and it can dramatically reduce the need for narcotics. So the first step in receiving a stimulator is a trial implant. This is placed percutaneously. There's two tiny leads that go around the spinal cord, and then the leads come out of the skin with a sterile dressing, and it's attached to a battery that doubles as a programming device. It's placed under sedation, not general anesthesia, so the pain doctor can ask coverage questions before leaving the implant. The leads where they should be. It's worn 5 to 7 days and then removed in the office to see if it's going to work. If over 50% pain relief is achieved, usually that's an indication to move on to a final, and a psychological evaluation is required by the insurance companies as a next step. How is the final implanted? Well, it's completely under the skin. The procedure takes about an hour. It consists of a large paddle lead for better coverage. The doctor does need to make an incision and bony removal to be able to get the paddle around the spinal cord. The leads are then tunneled under the skin to a battery, which is placed subcutaneously, typically above the buttock area. There's over 200 programming options available with the latest implants, and the new ones are actually rechargeable through the skin. The old ones, you had to replace the battery every few years. And actually the newest ones don't lose coverage as a patient moves from a sitting to a laying down position or standing up. They respond well to that. Well, how well do they work? There have been a few studies that have been done on their effectiveness. A St. Jude study that was actually fairly large showed 84% had life that was greatly improved for all types of conditions. A study out of neurosurgery in 2006 showed 77% good to excellent pain relief for all types of pain conditions. With diabetic neuropathy, 85% experienced substantial recovery of sensation, and over 3/4 had significant pain relief. For RSD, spinal cord stimulator works extremely well for pain relief over 75% of the time. Here you can see the size of the batteries now. There's a quarter, so they're really small, okay? And this is what the paddle leads look like. They have a lot of silicone diodes, which help a lot with the programming options. There are some risks. There's a risk of the device stop working. Thankfully, there's over 200 programs now, so hopefully you can get it working again. Or it may just malfunction, literally. The leads may migrate. There's a risk of wound breakdown, bleeding, infection. The top non-operative pain management in New Jersey is through the New Jersey Pain Network. There are several clinics throughout the state accepting over 50 insurances and providing over 25 treatment options with the board-certified, award-winning doctors. Visit us online today at newjerseypainnetwork.com and then call us for more information and scheduling at 844-2NJ-PAIN. I'm Dr. David Green with the New Jersey Pain Network. Your pain stops here.